Over the past 9 months, we started a national conversation on the linkage between sugary drinks and obesity. And despite yesterday's temporary setback, I don't think there's any doubt that momentum is moving in our direction. In the weeks and months ahead, we will continue to tackle the obesity epidemic, and more people who care about the damaging effects of obesity will do exactly the same thing. Not because they have to, but because they think it's the right thing to do, and that's why we're here at Lucky's Cafe in East Midtown. Lucky's has chosen to voluntarily comply with our administration's reform limiting the portion size of sugary drinks. And I want to thank owner Greg Agnostopoulos. Greg is the tall guy right back there. Wave your hand. And his father's name is Agnostopoulos as well. And I assume if he has a son, it's Agnostopoulos. And Hayden now owes me 25 cents because she bet I could not say Agnostopoulos, and I can. Bloomberg is a little bit easier, but not all the same. Anyways, but I want to thank Greg and his entire team for getting out in front on this critical issue. Lucky's recognizes both what the data shows and what our growing number of supporters have been saying for months. Sugary drink consumption is a key driver of the obesity epidemic in our city and across the United States. In fact, as a study released just yesterday shows, 9 of the top 10 neighborhoods with the highest citywide obesity rates were also the communities where New Yorkers consumed the most sugary drinks. So there really is an irrefutable, strong connection between sugary drink consumption and obesity. And that's why reducing the amount of sugary drinks we consume is the simplest dietary change any of us can make to help lose weight or maintain a healthy weight. We will appeal the judge's decision on the ruling yesterday. We are confident that we will win that, but while the legal case plays out, the conversation we started about the dangers of the portion sizes of sugary drinks has prompted many people like Greg to take action, and we came here to applaud him. Obesity is a national epidemic that is getting worse, and in New York City at least, we're not just going to simply wring our hands about it. The fact is nearly 60% of adult New Yorkers are overweight or obese, and each faces a greater risk of developing a host of diseases and conditions, including type 2 diabetes, cancer, hypertension, heart disease, kidney disease, liver disease, joint problems, and blindness. Of course, obesity doesn't just affect adults. Among New York City kids, nearly 40% are overweight or obese. So 60% of adults and 40% of kids overweight or obese. And each faces a higher risk of developing all the diseases I just mentioned. And tragically, each also faces a greater risk of early death. In fact, obesity is the second leading cause, just after smoking, of preventable death in our city. More than 5,000 New Yorkers die each year because they are overweight or obese. And nationally, that number is more than 100,000 preventable deaths and 70,000 just from diabetes alone. So this is a serious thing. Smoking deaths are coming down. Obesity deaths are skyrocketing. And in addition to the tragic human toll, obesity is also placing a growing burden on public finances. Obesity costs New Yorkers over $4 billion for medical care each year. Nationwide, that number is $150 billion each year. Now, if you care about the taxes you're paying and the cost of your medical care, this is one of the reasons why they are both so high. And if you ever want to bring them down, we're going to have to do things like this. Look at the causes, where we're spending our money, and do something about it if we can. And in this case, you're also helping you, your family, and your fellow New Yorkers, fellow Americans live longer, healthier lives. We realize that we can't simply treat the effects of obesity. We must help people change their lives before they ever need to enter a hospital. And that's what our new reform limiting sugary drink size is all about. It builds on the work we've already done to give New Yorkers more information, like calorie counts in restaurants, so they can make better choices about the food they and their families consume. And it is in line with earlier reforms like our ban on trans fats in restaurants. A study released in 2012 showed that New Yorkers, on average, consume nearly 2.5 fewer grams of trans fats per meal after we implemented the ban. So people think these things don't matter. They do matter. They can get done. They lead to changes in what people eat. and when they lead to changes in what people eat, they live longer. Life expectancy in New York City is better than 2 years greater than the national average, and this is one of the reasons, as is diminished smoking, as is lower crime, as is fewer traffic deaths and fewer fire deaths, and faster ambulance response times. Now, the study went on to say that not only were restaurants serving healthier foods, consumers were also making healthier choices. When we implemented calorie counts in our reform to eliminate trans fats in restaurants, I know there were more than a few skeptics, but today both reforms are recognized as national models. We are confident that yesterday's court decision in joining our latest health reform will be reversed on appeal, but in the meantime, I wanted to recognize and thank restaurant owners like Greg who are taking a stand on this critically important issue. This is something that each of us can do something about. We can do it for our families and encourage them to eat healthier. We can do it for our friends, talk to them, and if we sell food and sell drinks, we can do the same thing by being responsible and trying to help our customers live longer. In the end, our customers that live longer are going to be happier customers, and they're certainly going to be with us for a lot longer.